Hey there. My name is Craig Rodriguez Sayas. I am a licensed clinical psychologist working here at the University of Michigan. And if you're seeing this, it's because you've expressed some interest in our study on understanding a comprehensive assessment of psychiatric experiences among LGBTQ plus individuals. The purpose of this video is to tell you a little bit more about the study, what will be expected, compensation, things like that, so that hopefully you decide you would like to enroll in the study or not, so you just have more information. Um, I'm an assistant professor of clinical psychology here at the University of Michigan, and I run the Stigma, Psychopathology, and Assessment lab at the university. So what you're going to get from this video is a little bit about the study, a little bit more information about the hierarchical taxonomy of psychopathology, or HiTOP, that's what this study is about, what to expect if you participate, our compensation, and I'd just like to thank you afterwards for watching the video and for learning more about what we're trying to do here in my lab. So about this study a little bit. The HiTOP, or hierarchical taxonomy of psychopathology, is a scientific system that's emerged to improve on the limitations of our current model, the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. It's based on over a decade and even longer of research on understanding the dimensions and the domains that undergird the different diagnostic categories that we often think about. I'm a member of the executive committee of the HiTOP Consortium, which is a consortium, international consortium of different scientists and mental health professionals focused on improving our classification, assessment, and treatment of psychiatric disorders. As part of the work of the HiTOP Consortium, we've created a measure that it comprehensively gets at different domains that we think are important to understanding mental health among individuals. But the goal of this study is that, and my work in particular, and work of the colleagues I work with, is to ensure that it's appropriately representative of everybody in our population. So a lot of the work I do is understanding the mental health needs of LGBTQ plus individuals. And so this study is really about collecting data on this HiTOP measure to ensure that we don't leave out LGBT folks in the work of the HiTOP Consortium as we better understand mental health and better think about how we classify it and assess it. This is the HiTOP model. It's a little confusing, but let me just walk you through a couple important points. And if you're interested, you can check out the HiTOP website as well, or even my own work to learn more about this on the University of Michigan and my lab website. When you look at this model in the red box, this is typically what we think about, which is specific disorder diagnoses. So things like borderline personality disorder, major depressive disorder, or MDD, generalized anxiety disorder, or GAD. Now, the rest of the model up above are the different dimensions and domains that we think are important that undergird these different diagnoses. So this HiTOP measure is really focused at that level above, trying to get information about these different domains really comprehensively so we can understand and better improve the different disorders and the classification system that we use. If you participate in the study, what would you be doing? You'll be asked a variety of questions about your mental health, about alcohol use, about life experiences, and just different behaviors. And we just ask you to select the response that best corresponds with your experiences. There's no right or wrong answer for these questions. One thing to note is different questions have different time frames. So I'm going to walk through a couple examples so that as you're going through the process, you just pay attention to when we're asking you to think about. And for this study, through Prolific, you're going to be guaranteed compensation. I'll talk more about that, but we also have some incentives for raffles to win several bonus payments. So here's an example of the instructions you might see. In this section, you'll be asked to respond to a number of statements about your thoughts, feelings, and behaviors. Some of these things are pretty common, whereas others are less common. As you respond to the following items, please consider whether there have been significant times during the last month when the following statements apply to you or your thoughts and beliefs. Please select the option that best describes how well each statement described you or your thoughts and beliefs during the last month. And here's an example then. So in the past month, does this apply to you? The question might be, I lost a significant amount of weight without even trying. And your response options would be not at all, a little, moderately, and a lot. And you just select which one you think best applies to you within the last month. Another type of question you might see would be one like this. In this section, you'll be asked about how you have felt or acted most of the time since early adulthood, regardless of the situation or whom you were with. Do not include times when you weren't yourself or when you acted differently than usual because you were depressed, hyper, anxious, nervous, drinking heavily, using medications or medicines or drugs, or experiencing their bad after effects, or times when you were physically ill. So this one is really getting at about in your lifetime, in your adulthood, has this described you generally when you're your normal self? Have you often become frantic when you thought that someone you really cared about was going to leave you, and then you select yes or no, depending on your own assessment of yourself. Now, we thank you so much for participation. This is really important research for us, especially ensuring that as we create and improve our psychiatric system, we're not leaving behind the most vulnerable populations. A lot of my own work is on understanding the mental health needs of LGBT folks and treating that. However, we have limited resources. So you'll be compensated $8, the normal hourly minimum through Prolific. And while we wish we compensate everybody with more, we do have a few raffles incentives that hopefully will help with that. Now, we're hoping to get a few hundred people, so there are some good chances. And for the raffle, we have when you complete the study, if you don't fail any of the attention checks, those are embedded in the study, they're just simple items to make sure you're paying attention. You'll be entered into a raffle to win one of 80 $100 bonus payments. So if you're selected at the end of the study, we will then send that bonus payment through Prolific as well. I want to thank you very much for your interest in the study, whether or not you participate, for your interest in maybe our work. Your participation is really important to us to ensure that LGBTQ plus folks and their mental health needs are considered appropriately as we improve on our mental health classification, assessment, and treatment system. We at the Stigma Psychopathology and Assessment Lab, or the SPLAT Lab, are committed to understanding the mental health needs of LGBTQ plus folks and folks from other underrepresented backgrounds. So thank you for taking the time to watch this video. My contact information and my lab manager, Lindsay's contact information is here available. If you have any questions, feel free to shoot us an email. Feel free to shoot me an email as well. You can also check out, if you were to go look for the SPLAT Lab at University of Michigan, you can check out our lab website if you want to understand more of the type of research we're trying to do in the lab. So thank you so much. And I do hope that you will consider participating in our study. Thank you.